If you sit throughout most of the day and your hips or your low back are feeling tight and or achy, then this 10-minute video is for you. Hi, my name is Jennifer Schwolmeyer and I have a doctorate in physical therapy and I'm a nutrition health coach, and I am going to talk to you today a bit more about how mobility is more important than flexibility, and I'm going to provide you with a quick routine that will help you feel better in just under 10 minutes. So first of all, let's clear up confusion between flexibility and mobility. Flexibility is the ability of a joint to move through range of motion passively. So if I raise my arm up as high as it can go passively with my other hand helping, that shows you how flexible my arm is. Versus mobility is the ability of a joint to move through its range of motion actively and with control. Raising my arm up overhead with a weight, that is my mobility. I'm able to lift the weight up with good control and lower it down with good control, and that indicates good mobility of that joint. And it's important to understand that you can be flexible but still lack mobility, and this is often where pain and stiffness can creep in. When we focus on mobility, we aren't just talking about range of motion, we're actually talking about having control, strength, and stability in that joint moving through that range of motion, which is really important, especially for women going through midlife, when we're going through these hormonal changes that can actually cause more joint tissue stiffness and pain. When we sit for prolonged amounts of time, such as being on a phone or at a desk, our spine tends to stiffen, our hip flexors tighten, which pulls us forward, and our glutes, which are our butt muscles, tend to turn off. So it makes it harder for us to do certain activities. But this also causes more back pain and stiffness in our hips over time. Add into that midlife hormonal changes, so we're more prone to stiffness, weakness, and injury. So the solution for this is not just passive stretching, but daily mobility. The first exercise we are going to do today are called hip switches to help improve your hip internal and external rotation. The front leg is in external rotation, the back leg is in internal rotation. So in this way, we are multitasking and hitting both hips at the same time, and then we are going to switch. So you can start where you sit up tall in this position and hold for about maybe 20 to 30 seconds. And then you're going to rotate and then switch the positions where the front leg is in the external rotation and the back leg is in internal rotation. And again, really think about keeping your legs at 90 degrees. To advance this, you can try to not use your hands and actually just alternate sides going back and forth. Hold for about 10 to 15 seconds and then switch. That's going to be a more advanced version. Otherwise, just stay in that position and hold for about 20 to 30 seconds and then switch. The next exercise we're going to do is a cat-cow with a thread the needle. So you're going to be on all fours here in a quadruped position, hands underneath of your shoulders. You're going to inhale and look forward, arching your low back, letting your shoulder blades sag down. And then you're going to exhale, bringing the back up to the ceiling and pushing through your shoulder blades away from the floor. Then you're going to come back to neutral and you're going to thread the needle by putting your left arm straight out in front, right arm is going to reach through, and then you're going to try to rotate your upper back until you feel your shoulder blade touching the floor as much as possible. Hold for 5 to 10 seconds. And then come back, and then you can try the other side. Really trying to get that shoulder blade down onto the floor to get that thoracic rotation. Then you're going to come back and you're going to go through the cat and cow again. So you're going to inhale, looking up, letting the low back sag. Exhale, pushing through the low back, stretching the upper back and the spine, and then thread the needle through. Really exhaling to get more through the stretch. Coming back and switch sides. And then come back and you would repeat that 5 to 10 times. The next exercise we're going to do is in half kneeling. It's going to be a hip flexor stretch with a reach. So you're going to have one leg down at about a 90-degree angle, and you want to think about really tilting so a lot of us have an anteriorly tilted pelvis. We really want to think about tightening our abs, squeezing our glutes, and getting in more of a posterior pelvic tilt to really feel a nice stretch in the hip flexors. And then what you're going to do is just gently lean forward until you feel a nice stretch. And then to get a little bit more of an aggressive stretch into that hip flexor, you're just going to reach your arm up overhead toward the other side. Hold for about 20 seconds or so, really thinking about pulling that pelvis backward, squeezing your glutes, tightening your abs to feel a nice stretch into the hip flexor. You can also do a gentle rock back and forth just to open that muscle up. And hold. I also like to push gently into my knee with the opposite hand to get a little bit more of a stretch into that muscle. And then you're going to come back to neutral. You can bring the arm down and then repeat. Really try to posterior tilt that pelvis, pull the abs inward, tighten the core, and make sure you're breathing. And then you can come back to neutral. So that is the hip flexor with reach, and make sure you do both sides 3 to 5 times. The next exercise we are going to do is a hip bridge with a march. I'm going to use a stool to really engage the hamstrings because I'm going to rest my heels on the stool. That is going to really get those muscles in the back of your legs. Those tend to stiffen and get weaker with extended sitting. So let's go ahead and try this. The stool is about 14 inches high. You can use a lower one if you want, a little bit higher, whatever you have laying around. Okay, so what we're going to do is lift up our bottom to where our torso is pretty straight, and then we're going to just march, hold for a few seconds, and then switch. You want to really try to keep your torso in a straight line as much as possible. So if you're having a lot of trouble with this, you can probably just go ahead and lower your feet down to the ground. Go nice and slow and think about exhaling as you lift and inhale as you come back down. Aim for about 10 times, 2 to 3 sets to really engage those muscles. The final mobility exercise we are going to do today is the world's greatest stretch with a walkout. So as a physical therapist, I'm always thinking about ways to incorporate more shoulder stability, core stability into different mobility types of exercises. So this one, you're going to walk out into a plank position as you go into the world's greatest stretch. And then we're going to add a reach to really open the chest, which again tends to get stiff as we sit for long periods of time, and that over time pulls on the low back. So all of this is related, and this is a really great one if you don't have a lot of time to just do this one along with the other ones when you have extra time. We're going to start by standing at the end of the mat, and then we're going to walk forward into a plank with our hands. And then we're going to bring one leg out in front, walk your other hand, your opposite hand a little bit closer to your foot for stability. And then you're going to open up your chest by reaching up to the ceiling. Try to keep your arm nice and straight. You can let your knee drop out a little bit to the side if you want, or just to really work on hip strength, try to keep your knee pointed inward. And then open your shoulders, open your chest, really breathe into that rotation. Hold for a good 10 seconds. And then come back, and then go ahead and bring your leg back nice and easy. Walk back. Now we're going to start from the opposite side. We're going to walk out into a plank. Bring your leg forward. Move your hand in just a little bit, and then rotate, pointing your top arm up to the ceiling. You can let your knee drop out for a little more stretch, or again, to work on that hip strength and mobility, try to keep your knee pointed forward, and then hold, really opening that trunk, opening your chest, pushing your hand toward the ceiling. and breathe. And then come back, bring your leg back nice and easy, and walk back up. So you can start on one side if you want to and do a few in a row, switch positions, go to the other side, and I would aim to try to do that 5 to 10 on each side. Remember, mobility is our foundation. It's not just about being super flexible, it's about being able to move with strength and control. Try to do this routine daily and see how your hips and your back feel more open, supported, and strong. If you find this content valuable, be sure to give it a thumbs up and follow along. Subscribe to my channel. I am going to continue to provide tips to help you feel better, move better, and live the life that you deserve.